voice is okay. Can you make it a slideshow? Okay. Assalamu alaikum, everyone. Today will be our second last lecture, and our speaker is Dr. Khurram Shahzad. Mashallah, everyone can see on the screen his certifications. इनका बहुत ही vast experience है. Form D today किया हुआ है. He has done his Form D. He is board certified in oncology, and he's also board certified in sterile compounding, and he's also certified in the sterile compounding from ASHP, and he has also done healthcare quality certification. Advanced immuno oncology का certificate उन्होंने लिया हुआ है Harvard Medical School से, and he's working as a senior oncology pharmacist and in charge training, development and quality control. He's working in King Abdulaziz Medical City, which is under the Ministry of National Guard Hospital.
Continuous readiness and legislation. So before jumping into the direct presentation, I'll just have my disclosure. I have not received any financial or commercial funding. I have no specific, Dr. Sarwat and all the participants are there. So we'll try to keep it as a more interactive session. So if you can, I will ask a little bit of questions for you, for your practicing. So if you can, reply back or interact, it will be very good for us. The concept of this presentation or this chapter was to make you ready for the CPHQ exam. So that's why I make it, these slides are more descriptive. I took it from the book and from one source that been used to train for the CPHQ people. So for the training or those who are going to appear in the CPHQ. So it's mean if you have these slides, so you can go through for it. In a descriptive way, it will be enough for you. And second objective is that if you are preparing for accreditations, so this presentation gonna give you a very brief or very generalized kind of idea or concept that what is accreditation and how you can go through it. Because once if you're working in a quality, if you're working in a hospital setting, in a healthcare setting, when they ask you the JCI is coming or accreditation is coming, so sometimes you are lost from where to start. What are the concepts? And if you are working as a quality as a healthcare quality person, so then you must know from the A to Z about accreditation standard, about what kind of surveys you required, what kind of steps they are inside. So we're going to discuss in detail about all these things. So very quickly, I'm going to tell you about my learning objectives. We're going to go to see how to assist with the survey or accreditation readiness. Then we're gonna touch about the selection and preparation for the quality recognition program. We will evaluate compliance with internal and external documentation, develop or provide survey preparation training, communication with accrediting and regulatory bodies and hospital accreditation organizations. So very quickly, I will just refresh your concept, or I will let you know that what is the CPHQ exam and how many questions will come. There will be total 140 questions from there, and then you have to answer 125 questions. 14 questions will not, you have to answer it, but it will not be considered for your marking. The most important thing, you have to understand what kind of questions will come. There will be recall questions, there will be application questions, there will be analysis questions. So you have to, when you are reading the question, you have to focus and you have to identify either it is a recall question, either it is an application question, either it is a analysis question. And the percentage of that particular domain is already, I have mentioned, there's a 32% recall question will come, which is a very good number. 53% is of your application question, where then the check is your real practice. And then 15% of your analysis questions. So you have to identify your question. That is very, very important. So what is a recall question? They will test the candidate's knowledge of specific fact and concepts. And what is the application question? Require the candidate to interpret or apply information to a situation. And about analysis question, they're going to test the candidate ability to evaluate, problem solve, or integrate variety of information or judgment into a meaningful whole. So you have to identify exactly your question. Okay. So we will go directly now into our presentation. So let me give you the concept of accreditation versus regulation. So can I ask a simple question from you guys, just to be having an interactive? If you want to answer, it's okay. If not, then we're going to discuss it. Like, if I'm going to ask you which beverage you like it, Coca-Cola or Pepsi, and why you like it, Coca-Cola or Pepsi. So anybody want to give answer or just want to interact on that? Is it okay, Dr. Sarwat? We can take it.
Yes, we can take. If you have time,
yes,
we
exactly.
can take. Otherwise,
we have time. I'm gonna just spend some time of 5 minutes over here so that we will have a healthy discussion on it. They will accept the concept of that.
Dear everyone, please,
anybody want to answer this question? Yeah, I just asked question. Which beverages you like? Just give me that answer. Anybody?
Yes, Assalamu alaikum. Faisal here. Can you hear me?
Yes, I can hear you, Faisal.
Yes. I like Pepsi because of its quality, its taste, and all the things being branded over there. So a lot of things get me towards Pepsi as compared to Coca-Cola.
Thank you very much. You, mashallah, very, very excellent answer. So if I get from your question, from your answer, you said I like quality, I like taste,
yes.
Right?
And the
there are other things also. So
yes,
the same thing is in Coke as well. If I say that this all things are in the Coke, would you will go for it?
Maybe I try one or two times, but whatever would give me more satisfaction, more appealing, that will be more continuing beverage for me.
Yes, so it's like in a brand conscious or brand loyalty, if I would say that one. Or if I will put a question like this, like the Coke is not FDA approved, while the Pepsi is FDA approved, then you will go for Pepsi?
Definitely.
Definitely. Thank you very much.
Yes,
that I would want to yes, please go ahead.
Yes. Only whenever we are improving our knowledge about anything, because at one day we know some little things about that. With the passage of time, whenever we improve our knowledge, we got the new ideas, we go for the best out of best. And if one thing is FDA approved, which are the benchmarks, we definitely go for that.
Thank you very much. You make my presentation almost done, and my presentation very easy for the other guys. Thank you very much, Faisal. Thank you, so nice of you. So you have listened our discussion, all of you participants. Yes, when I said I said there is two beverages, Coca-Cola, Pepsi. So it was almost like there was nothing. When I added a one very reputable organization behind any product, everybody switched for that. So I think I created the doubt inside, isn't it? That is what happening when you select the healthcare as your treatment option. Okay, like if you are going in the hospital, the process is so complex. Whenever I go in any hospital, I think I lost it, where I have to go it, either I'm going or not, is it okay or not? And we don't know, like the patient, they are not doctors or they are not from the healthcare. They just have to come to take their treatment. Okay, so the concept before the quality came into the healthcare, the concept was you just have a very good structure, you just have a very good physician, he's qualified, fine. And if you have a very good nurses, that's it. There was no quality. So they are providing whatever the process they are providing, how the patient will come inside and he is getting the appropriate medication or treatment or whatsoever, fine. Nobody knows about that one. So you have structure, you have physician, you have the nurse, that's it. That's called the hospital healthcare system before. Now when the quality came, they are going like this physician, what kind of qualification he has, it's been done or not, it is legally required or not. Like if you have to work as a pharmacist in any pharmacy, are you registered in that particular state or organization or whatever the country is it as in a standard? So the legislation is the first thing, regulation comes the second thing, and the third will come the accreditation. So if we will go about the definitions, we will say that because it is unlikely that all providers will or can keep up with the best practices, and there are too many competing pressures for attention and resources, as we said, this creates a need for more prescriptive solution to safety standards set by the external organization, such as regulatory bodies, peer representatives, and government. Similarly, healthcare regulations and accreditation standards are dynamic and ever-changing. Regulation is an authoritative rule, while accrediting is a process by which authoritative body by formally recognize that an organized or a person is competent to carry a specific task. So that is the difference between the accreditation versus the regulation. Is that clear? Okay. So then the concept will come, what is the accreditation versus certifications? So we will go again back on the definition of accreditation. That's referred to a process of reviewing an entire organization's operation. It's a voluntary process granted by a private sector organization. So you're gonna go and check each and everything of the organization. Like I'm gonna give you the example that if you're gonna answer it, fine. Like you are working in a pharmacy or in a nursing station and the refrigerator is been out of order. So what you will do as a first case? Anybody want to answer that one?
First of all, we will check for the electricity, something like that. Its fridge is being remain closed or not. We have to verify the fridge functionalities.
Very nice.
And if we found
is it
then we
Dr.
can
Faisal?
contact. Yes, we can contact the yes.
Okay.
Yes,
fine.
yes.
Good.
Yes, ma'am, I'm Faisal. Yes. Okay. So we can check out first of all these things if it is out of order, and we have to fix so that the storage of drugs cannot be halted. And if we cannot do anything about that fridge, we have to immediately inform our facility management, which is doing all the things. If we are in a local or something, and we have to transfer the medications to the nearby safe storage area.
Yes. So you Dr. Faisal, you have told so many things. Fine, this is absolutely providing proper step. So is this steps are documented anywhere or guided, or it's just your application, your first response to it? So if I will say that if I will write all these lines, if everything I will write for you that whenever your ref is out of order, you have to do this 1, 2, 3 steps. It will be more easier for you, or if I will ask you to take your application step on it. What will be easier for you? Easier, of course, easier will be if thing is written properly for it. If there will be a proper policy for it. So it will be very easy, isn't it? Yes. So that is why the accreditation is important, because they're gonna review your whole process. Okay. So they know that if something gonna wrong, you have to do like this, and they have to gonna check for that. Okay. So this is accreditation basically. So what is the certification? Certification is recognition for meeting special qualification. Like you done your JCA certification, you want to go for more oncology certification, then you have to go for another organization which will specialize you either in the BMT certification, either with the COPI, like Quality Oncology Practice Initiative, or something else. Or you have cardiac specialty and you want to take some more accredited organization to provide you the specialization in the cardiac certification. So this is another step after the accreditations. So this is, am I audible?
Yes, Dr. Khurram.
Yeah. Okay,
you're very
fine.
clear, yes.
So, yes, okay, fine. So please note this slide. This question is mostly comes in the CPHQ exam. Okay. So in different types, sometimes it's a recall, sometimes it's in a different. So what is a deemed status? So for deemed status, we have to understand what is the condition of the participation. What is the deeming authority? What is the deemed status? So condition of participation. Let me clear you by reading on that. So healthcare organization to participate and receive payment from the CMS, which is the Centers for Medicare or Medicaid or Healthcare Insurance, it must be certified with the standard. So it's mean like if you are in the States or in any country, if you have to pay back or as an organization or as an insurance person, you have to register yourself or accredited by something so that they can pay back you. So deeming authority, what? If a national accrediting organization enforces standard meeting, the federal condition of participation, CMS grant the organization a deeming authority to conduct a survey. Like that CMS, they grant some of the accrediting agencies to you are a deeming authority, you can perform that particular type of accreditations. So it's mean that if they have to choose some organization, they will call as a deemed status. So the organization would not be subject to a routine separate survey and certification process conducted by the state or regional CMS offices. So they will be conducted the survey by these deeming authorities, and that organization is called as a deemed status organization. So until they clarify it, they will accredit it, they will receive the certification from the CMS office. So this is the concept of the deemed status. So if we will go for the example of the accreditation agencies all over the world, there are different type of agencies. Sometimes they have to more specialized in it. So it depends upon your practices, about your organization, and what kind of strategic goals you have it. So that's why you choose on that. I will just name it the Joint Commission, very important, very famous. The Community Health Accreditation Programs. We have College of American Pathologists, American Association of the Blood Bank, or American College of the Radiations. And there are a lot others as well. So it's depend upon what your specialty is. Well, that's a very important slide. You have to understand, that's why I asked the first question about that, the choosing of the two brands between them. So why the benefits are there? Are a lot of healthcares are available. Okay, so why you gonna choose as this? If you are going in a hospital, if you're going in a restaurant and you are spending a money, okay, and you must know that, like, if I go to restaurant, I want to spend money, so I need a quality food. I will not go to any other simple kind of restaurant and pay a lot of money, and I will not get the quality food. Similarly in healthcare, because you don't know the medication, you don't know about, as a patient, what kind of treatment I have to be offered, either it is right or not. So that is why the medication errors happen in a lot of organizations which are not being accredited by the external or internal agencies. So the important thing comes the credibility, externally and internally, both sides. So if you are accrediting, is your credibility on that through improving an organization reputation, enhance quality awareness, and improve internal and external communication. Then improve the quality through improved patient outcomes and create well-defined visions for sustainable quality improvement initiatives. Staff effectiveness. If you are working in an accredited or a certified kind of organization, it's mean they are spending on the staff. They have kind of processes to uplift, to upskill your staff, and they have different kind of courses or the team activities to make their staff competent from the other organizations. And ultimately, whatever is this is all patient-centered. Whatever the quality will become, it was a patient-centered, and to reduce the cost for the organization as well. And organization develop, learn, and uplift and grow by learning from these kind of accreditations or certifications. So if we will go for the process, if like you are working as a quality care person and they say that we want to start the JCI certification or any accreditation, so from where you will start it? What are the steps listed in the book and what to do with this one? So the first step is you have to submit an application. It's a readable, it's on a recall type of thing. So you can read it later on. I will very quickly read that one because it's good to know about the things. So then second, then you have to accrediting organization review the application. Then a survey team will be assigned and a data survey is determined with the applicants. Then the documentation will be started and may be requested on on-site review or submit in advance, either electronically or via email system. Then there will be on-site review conducted by the professional with the credential in the field of the review. Then the length of the on-site review is dependent upon the size of the organization and the complexity of the services of it. And the process will continue, like they will come to make an on-site review, including document review, observation of care, and interview staff and patients, and submission conference by the review team to inform leadership of compliance findings and accreditation scoring. Why this looks descriptive, I'm telling you, but when we will go over the practice question in the end, you will see that might be you will feel that I'm reading this one, so it's not catchy or it's not something, but this topic has questions from the recall, and when you will go for the questions in the later on in the slides, you will see that one. So a report of findings may be left upon the review team exit or provide to the organization. Any deficiencies or requirements for improvement must be corrected and documentation submitted to the accrediting organization within the predetermined timeframes. Then accreditation status is listed on the accreditation organization website, public information. They will publicize and they will inform it. And then the periodic assessment helps to ensure the continuous compliance. So these are all the steps from the A to Z. You have to do it. So then after steps, you have to know what accreditation requirements are. Okay, so the first important requirement is the patient safety standards. So which includes requirement to establish patient safety standards, developing a culture of safety. And that is, believe me, it is very, very difficult. And I will do a 2-minute kind of discussion on that as well. Culture of safety, you have to inject. It is very, very difficult, to change the culture if you are in the quality setting. So using prospective analytical tools to prevent medication errors or medical errors, redesigning process for patient safety, disclosing outcomes for care to the patient. So these are the requirements for the standardization or accreditations. Then of course the patient safety goals. We all knew about that, there are 6 goals or 5 goals. We have to work on it, and they have different kind of expansion inside. They have different policy on it. We have to go for that one. Then staff effectiveness. I mean, are your staff is overcrowded, overloaded, or you are understaffed, or you are overstaffed? So you have to know about that, the staff patient ratios and type of staffing on it. Then very important requirement is sentinel event policy. It's a policy from the JCI explain how to identify, report, evaluate, and prevent that kind of errors. And it is very, very important. If the institution, they doesn't have the feedback system or reporting system or safety reporting system, I mean, if there will be no problems are coming, how are you going to know that there is an issue? Then periodic performance report. It's the completion of a self-assessment of compliance with the standards, an on-site survey by the JCI or JACO, in which written plan for action on the non-complement areas of the submitted survey within the 30 days. You have to go for that. Then an on-site mid-cycle survey is also conducted for that. So once you check the process, once you check the requirement, then the third step is that you have to get ready for it. So I'm going to ask a simple question here as well. So if you are going for a trip to Pakistan or trip from Karachi to Lahore to Karachi, what you will do in that? Can anybody give me 1 or 2, 3 things? If you are planning a trip after 1 week, and Dr. Sarvit, if you are there, you can participate in that. You will be very good right now to give this answer.
Actually, I want the audience to participate in this one.
Okay.
Definitely, I will plan.
Even our discussion will be participation.
Yeah, definitely, I will plan, and I need to check the weather. I need to check how long I will stay. So I will just get the.
So you will not take a just time decision that tomorrow I have to go. Yeah,
you have to plan earlier. Because especially during the COVID, you have to plan, I think 7 days before.
Yeah, exactly. So COVID is in a special situation over here, isn't it? Yes, exactly. So this is kind of sentinel event. So if a special situation will come, it is out of the graph. So it means a special requirement is required for that. Thank you very much. So yes, so if you want to ready for anything, you have to choose what kind of preparation you must have inside. Either you have a just in time, or you have to plan for this. So just in time accreditation readiness model, what is that model is? It's a model used by some organization as preparation for accreditation only months prior to anticipated survey. This model requires tremendous additional personal and financial resources. In addition to the compliance to the standard in this model is not sustainable. So it means it is okay, but it's not sustainable. You have a lot of problems and a lot of situation if you are not prepared before time. So what important thing is if you will go for the continuous readiness culture, for the preparation. So like you want in just in time, or if you want to prepare before, so you have to use all these tools work on it. You have to focus on your culture. You have to focus on your continuous effort, your readiness, and your compliance. So what is culture? Culture is very, very important. You have to define as the set of the shared attitudes. Okay, I will might be if somebody will take 2 minutes or something. Faisal, are you around? Sorry, Mr. Faisal.
Yes, I'm
Yes. Are you working in pharmacy or hospital or what?
Yes, I'm a pharmacist in charge inpatient pharmacy, Shifa International Hospitals,
Okay. So
recertified
Faisal, I
from
want to
Joint
ask you.
Commission accredited. Yes,
Thank you very much.
yes,
So
yes.
Faisal, I just want to ask you, because we are going to talk about culture. So you are a right person to give the answer. You are an inpatient in charge. Okay, fine. You added a new
Yeah,
setup of verifying the protocols. Okay, or the medication in the system. Fine.
yeah.
How you feel that you added a new system in your practice? Is it will be acceptable very easily by your staff, or it will give you something kind of resistance on it?
No, every time, every change has the resistance. By
Resistance.
first, it will be me. I will be
Yes.
accepting those. Human nature is
Yes.
not easy to
Easy
accept
to.
any kind of change.
So
So
it's mean.
resistance, we have to minimize that.
Yes. So resistance. So how
Yeah.
to minimize the resistance? This is a very, very
Yes,
important thing. Like, so if there will
yes,
be a culture, like if you train your pupil in a way that they like to adapt the innovations or creation, if you
yeah.
train them in that way, it means the culture is changed. They are as equal of thinking proportion as you are thinking as an in charge for it, isn't it?
Yes, we must go for some non-punitive actions. Whenever I can share with the participants, when
Yes,
we
exactly.
started for our preparations for joint commissions almost 9 years back, and we got first accreditation in 2017, and Alhamdulillah we got that, and in 2020 we have recertified as well. But in 2012, once we were asking about JCIA, it was a hawa for everybody. आप
Yes,
समझ सकते
exactly.
हैं कि ये क्या चीज
Exactly.
कैसे कैसे.
Exactly.
First we have to adopt ourselves from top to
Yes.
bottom. The
So
change
culture
doesn't
is
come
that
from
if the
bottom to top.
management will adopt it, the
Yes,
culture will develop on
yes,
it. Okay.
yes.
Thank you very
It
much.
is
Thank
from
you,
top to
Faisal.
bottom. Top to bottom. Yeah.
So nice of you from hearing from you. I mean, you are helping me out in my presentation. Thank you very much, brother.
Thank you.
So the culture is very, very good. It's a shared attitude. It's a value. It's a goal. It's a practice that characterizes a company or corporation. It's very important. Until you will not change the culture in a positive way or a process, you will not able to achieve that one. Then continuously, you don't have to interrupt in that one. It's not like a just in time. You have to prepare and you have to continuously educate on them. Readiness is defined as being prepared mentally and physically for some experience or action, immediately available or ready for immediate use. Okay, readiness, this should be there. And I will just give you example, like if the JCI will come, every institution sending the email, Faisal will second me on that one, Dr. Sarwat as well, that there will be no vacations on it, isn't it right? So
Yes,
Yes.
yes.
this is
And
this is very
overtime,
important. Yeah,
really,
the
overtime.
people are not ready. Even they are ready, they want to run away. They don't want to. I mean, I have because I wasn't involved. So every time there was an we say there is a 2 to 3 o'clock, there will be a survey. Everybody want to go break at that time. Exactly. So the readiness
And
is
what?
that you have to. Sorry. Yes, Faisal, go ahead.
Yeah. I want to add the Joint Commission or any accreditation. Just bring all the people together. I can understand
Exactly.
the working of nursing. Nursing can understand mine. I can understand
Exactly. It's an
physician.
integrated
But
approach.
yes, it is a bonding. And once we got the Joint Commission accreditation, I can share with you that the internal satisfaction and all those kind of feelings were
Exactly.
there, that हमने
Exactly.
बहुत कुछ पा लिया है और अभी भी
Yes.
बहुत आगे है. तो जॉइंट कमीशन इज नथिंग. ये जितनी चीजें
Yeah,
हम बात कर रहे हैं ये
exactly.
सब आपकी
Exactly.
डेली हैबिट्स हैं. दीज आर हैबिट्स.
Please,
आप
if
किसी को अगर
participants, Faisal, I will stop you over here. Well, Faisal, just
या या
what Dr. Faisal is saying right now, exactly the same question will come in the exam, and this is the question I have it right now with me. I will show you in the later. And Faisal, thank you very much for putting this concept, this point on it. Sorry, I disturbed you because it was just came in my mind. So you can go ahead
No,
if you want to.
yes. I was just sharing that we as a quality person, people just going around these. ये जितने हम लोग involve हैं इसमें, ये सब इस चीज को जरूर देखें. इन आपकी अपनी तो एक growth या वो चीज आएगी. Definitely you will improve. बट इसका ऑब्जेक्टिव और वो चीज पेशेंट सेंटर्डनेस पे आती है, पेशेंट सेफ्टी पे आती है। ये जितनी हमारा आज ऑलमोस्ट 10वां 11वां सेशन है, ये सेफ्टी की तरफ आता है बाय वन वे और द अदर. Right now, I am doing my some home task, and at the same time, I am getting the lecture as well. Thank you very much for this opportunity. हमारा ये जो फोरम है ये सब कुछ कर रहा है. So सर, गालिबन आप भी अपने घर पे बैठ के
सर, I think we should thank you. आप highly like आप बहुत अच्छा participate करें और आप अपना experience share करें. We should be
please be with us, huh? Don't be get busy in your home task. Okay, we'll move on that. I hope it's not the washing dishes.
No.
Inshallah, inshallah, Dr. Faisal, next cohort में हम आपसे राब्ता करेंगे कि आप
yeah, definitely you must, Dr. Sarwat. Okay, fine. So thank you very much. We'll go a little bit faster. So readiness, as I told you, we discussed that one. Sorry. Okay. So compliance, the last thing is compliance is basically a fulfilling official requirements. Survey processes are not one of the most viable and mechanism for demonstrating compliance. Am I audible, Dr. Sarwat?
Yes, Doctor.
Okay. So survey requiring the continuous readiness. So what kind of survey you needed? Like you want to start your accreditation. So before that you have to go and check, are we ready or not? Sorry?
No, I think it was by mistake.
Okay. So we have to do a corporate survey. We have to do an accreditation survey. And then again, all things will come to your culture. So corporate surveys that is conducted by the internal corporate consultants to evaluate compliance with the company regulation or policies. Then with the survey that conducted by the health insurers or peer for healthcare services to ensure compliance with any condition of participants. And then there is accreditation surveys, that is the culture is a system of beliefs and action that characterize a particular group. Culture also refers to the norms of behavior and shared values among a group of people that I already discussed in that particular discussion. So it's basically a powerfully influence human behavior. It can be difficult to change. Invisibility makes hard to address directly. So that's why you have to do the surveys to see where you exactly standing on and where you have to go beyond that one. Okay, so what survey require is they require the norms of behavior and shared values, as we are explaining more and more in it. So norms of behaviors are common ways of acting that are found in a group. They persist because group members tend to behave in a way that ease this practice to a new members. So I will just say that the individual, explain in that way that the individual thinking is different and the mob thinking is different. So sometimes if you are bringing any change, the people, they will not accept it. So what they will do, they will go for the soft corners and try to making on their side. Okay, so it will become a group. So it's difficult to change one person. And then if they become a group, it is very difficult to bring the change. So the norms of behavior, you have to study well during the survey, that how's your team is there, how your staff is there, what kind of problem they are facing it. Either they're properly educated, either they're properly skilled, either they're properly uplifted or not. This you have to do, and you have to reward or penalize on that one. Then the shared value, you must have one concept and one goal. You cannot say that we want to go to Islamabad and you go from that way and I go from that way. We have to share a same plane or same bus if we want to reach on a proper time. So survey requiring for the continuous preparedness is pupils are unaware of their organization culture until it is challenged, until they experience a new culture, or until it is made overt of exploit through a framework of models. The most frequently cited reason given for failure was a neglect of the organization culture. That's what we are discussing in that discussion, that the culture is very important. If you don't have a learning or friendly culture or whatever you want as a strategic goal, it will be very difficult to bring change. Implementing a culture, and there are Daniels and Mathers in 1997, very old time, they suggested that the significant results can be experienced into 6 to 9 months. You cannot bring the change in 1 or 2 months. If you will force them, it will go different way. If you want to try to do something else, there are different ways to bring that change. And this is a very totally a different topic, but very important one. So change will come slowly and gradually. That's why the accreditations are not very fast or very, in time kind of stuff. So you have to spend time, you have to be patient, you have to spend proper educational things on it, and then gonna be useful for that. Then the continuous readiness program, leadership commitment. This is the very, very important thing. Until the leader is not there, nobody gonna follow that one. So they must be in a place of readiness program, be successful and sustain. As a leader, you have to go, you have to do the round, you have to be put yourself in front of everything if you want to achieve that one. They must commit to a personal change and create a culture of readiness. They should align a staff, they should understand business case of compliance and cost of non-compliance. They must include continuous readiness with organizational strategic properties, that what we told and discuss on that. So they will also be willing to hold managers accountable for readiness and responsibilities. So your managers are often from the top leadership to the down leadership. Everybody has a very important role. So managers play a key role in continuous readiness activities. The compliance is evaluated by what happens to the patient at the point of care delivery, which manager is accountable for. Also, the healthcare quality professional must provide the program structure, education to help manager understand their accountabilities and to be successful. And believe me, this is a very tricky one as well. Everything sometimes they put on the managers. If you